Hello, everyone. I hope you're well. Thank you for joining us today for FP's virtual dialogue, which we're excited to present in partnership with the Millennium Challenge Corporation, MCC. My name is Carol Pinot. I'm a journalist and filmmaker, and I've spent much of my career reporting on Africa. I'm excited to serve as moderator today for FP's virtual dialogue. Today, we're going to be exploring a fascinating and important topic regarding the vital role of infrastructure in enabling a more robust, resilient, and effective healthcare system, especially in the context of developing countries. This is crucial not only as we think about responding and recovering from the COVID-19 pandemic, but also with regard to supporting more sustainable, self-sustaining development efforts that reduce poverty and promote economic growth. Today's dialogue will feature expert voices from Lesotho and Timor-Leste, and we'll also be highlighting the Millennium Challenge Corporation and their approach to economic development. On that note, I also wanted to take the opportunity to thank MCC for helping to make this virtual dialogue possible. A few quick housekeeping notes before we dive into the conversation to make sure that you can interact with us during this session. For those of you logged on via the Zoom app, you'll see a Q&A button at the bottom of your screen. Click the Q&A button and a window will appear where you may submit your questions. Please submit your questions and comments as they come to mind. We'll address as many of them as possible during our session today. When you ask a question, be sure to provide your first name, your organization, and the location from where you're calling in. For those calling via phone or watching the live stream, you can submit your questions as they arise via email to events@foreignpolicy.com. Please provide your name, organization, and the country or region you're joining us from. We also encourage you to join the conversation on social media using the hashtag #InfrastructureForHealth. Now let's get started with the program. I'm excited to introduce our first distinguished panelist, Sean Cairncross, CEO of the Millennium Challenge Corporation. Prior to joining MCC, Mr. Cairncross served as Deputy Assistant to President Trump and Senior Advisor to the White House Chief of Staff. Before his work at the White House, Mr. Cairncross served as the Chief Operating Officer of the Republican National Committee for the 2016 election cycle. So Sean, welcome to our program. Please join us on screen.
Okay, can you see me, Carol?
Yeah.
All right, terrific.
So Sean, you know, for a long time, foreign aid focused on health and education. And more recently, there's been a big push for infrastructure. COVID-19 is really showing us there needs to be far more investment in both, in investment in healthcare and in the supporting infrastructure that allows healthcare to function. How do you see this nexus of healthcare and infrastructure?
Yeah, well, first off, thank you, Carol, and thank you to Foreign Policy for hosting this, and Ambassador and Minister for joining. I think this is going to be a terrific conversation. Carol, I think that's an important question, and I think MCC is a great example of building the sort of supporting infrastructure that makes a sustained economic development possible and strengthens the needed healthcare sector services, both directly and indirectly. And so just a quick overview, the way that MCC works is to work with our country partners and identifying the core constraints on economic growth. And it's really data-driven. It's data-driven and it's country-led. So we follow what those core constraints are. And once identified, and working with civil society stakeholders in country, set about setting up that 5-year typically hard infrastructure project. It's time limited. It's called a compact, and it's got to finish on time and on budget. And with that, we drive the sort of institutional and policy reforms that ensure that service delivery is efficient, that access is improved, and that the results are monitored and evaluated and sustained over a long time.
You know, I'm particularly interested in this issue of taking a very analytical approach to development. Can you give us some examples of how data can really make more impactful development decisions?
Sure. Well, I can give you a couple. Let's talk about the nexus of healthcare and infrastructure. So, data has taken us in some of our projects directly at the health sector, and a great example of that is our first compact with Lesotho. In 2007, we entered into a $362 million project with Lesotho. 40% of those funds went to a health sector project. And the data told us this is where we needed to go. And it funded the reconstruction and rehabilitation of 138 healthcare centers, 14 outpatient departments, which is 90% of the facilities available for that in country, a national reference lab, blood transfusion services, technical support, and waste management. And among the results that have come from following that data, blood units collected by mobile units have increased by 124%. 200 healthcare practitioners have been trained in infection prevention and disease control. And so those are sort of the direct feedback that we've had from following the data. And then we have multiple examples of where indirectly, and typically in water, sanitation, and health or WASH programs, where we've engaged in projects that have benefited the surrounding supporting infrastructure of the healthcare center, of healthcare services. And just one example of that is in Ghana. We're engaged in a power compact, and there's a hospital, the Corla Blue Hospital. It's a 600-bed university hospital that doesn't have reliable power, and we've worked on 6 substations that help provide reliable power. So that's vaccine inventories, lighting for surgical procedures, the sort of basic needs that it's easy to take for granted, but if they don't exist, that infrastructure, if that infrastructure doesn't exist, those services will be negatively impacted to a tremendous degree.
Yeah, you know, one thing that's really interesting about MCC, you don't work everywhere. You're actually very selective on where you work. And I think data has a big part in that, right?
That's exactly right. We're a foreign aid agency, but we're different. And we were designed specifically to work with the best governed, poorest countries in the world. So we work only with low or lower middle income countries. And then we move to look at objective third-party criteria having to do with good governance, economic freedom, and a government's investment in their own people. And there are 20 categories that we use, and we have a scorecard system that's available online. All of our data and information is public. In fact, in some exciting news for the agency, Publish What You Fund just ranked us the #1 agency in the US government in transparency. And it's a huge win for the agency, but it demonstrates the sort of commitment that we bring to our projects and what we bring and provide working with our partner countries. And so it's that model of US foreign assistance working with governments that are working to connect and be responsive to their people and producing democratic reforms that really drive the agency forward.
Yeah. You know, you mentioned earlier country ownership, and this has become such a buzzword throughout development. Why is it so important?
Yeah, it's vital, because if there's no ownership, if there's no buy-in from people on the ground, the project isn't going to succeed, and it's either not going to succeed or it's not going to be sustained. And so, for example, if we're engaged in land reform, we're working with the individuals and the sectors that are going to be affected if people are going to need to be moved off of farms or land redistributed in some way. that's something that needs intense local community buy-in. And there's a great anecdote that I had when I was in El Salvador. I met with a group. We're doing a water treatment project with a village, and it's a $6 million water treatment plant. And we met with the local villagers, about 50 or so. And what they said to me was, at the beginning, they didn't believe, when they heard about this project, they didn't believe that it was going to happen. And they didn't trust their government interlocutors, what they were saying. But in working with MCC, and even more importantly, the conversations that they've had with their own government officials, they've bought into the project. That project is coming online now, and they are big supporters of that project. And so they were there thanking the United States for helping, but also thanking their own government for the engagement that they've had with them. And that means that that is something that is going to last.
You know, another thing that I think is really important, especially with the vast resources that are going to be needed to deal with the aftermath of COVID-19, is the private sector coming in. And it used to be the private sector was completely separate from aid organizations, and now they're kind of being brought together. How are you leveraging the private sector for what you're doing?
I think it's very important, and we're very excited at MCC. We just made blended finance part of our institutional investment criteria. And so what that means, it's never been done before in the agency's history. And we did, by the way, the same thing with women's economic empowerment. And so what that means is every project internally, as it goes through our investment management committee process, for the entire life cycle of the project, that lens has to be put on the project, from design and development to implementation. And so rather than designing a project and looking to gap fill with private sector funds or partners, we're looking at the front end. What sort of needs does the private sector have in this market? What's holding investment back? What are ways that we can partner on projects and maximize impact long term? So that's something that's now built into the cycle of our projects. And I'd also just put in a quick plug. We launched on our website a US procurement map. And so this is it's a rollover map of the country, listing the firms and the businesses that MCC has partnered with in the United States on our projects, because we're trying to increase that private sector engagement, make people aware of what we're doing and the opportunity. It's access to these markets, and US companies in particular bring that sort of transparency and openness and economic analysis, environmental concerns, gender and social inclusion concerns that we're looking to build also in country. So we're on all fronts looking to maximize our work with the private sector.
Well, thanks so much for that, Sean. You know, we're going to do a quick audience poll to take our viewers' pulse on infrastructure that's needed to support healthcare. This poll can only be accessed by our audience on Zoom. Now, a window should now appear on your Zoom screen, and the polling question, so please select and submit your response. The question is, which healthcare supportive infrastructure do you think needs most investment in developing countries? And you can choose among them: energy and power, water, sanitation and hygiene, WASH, or transportation. And I know a lot of you will probably be saying, why isn't there an all of the above? We really want to get some priorities here. And within just a few seconds, we should be able to have some answers. Sean, maybe I can be indiscreet and ask you, while we're waiting for everyone to answer, what do you think is the most important? Where's your priority? And you're not allowed to say all of the above.
No, I wouldn't say all of the above. What I would say is I would let the data tell me in country by country what the priority is. But I'll give you a couple of examples. So in Liberia, we worked on a transportation project that increased access to the healthcare service sector. And so that is what the data told us in Liberia. Like I say, in Ghana, we were working on the energy and power project that has a health care supportive infrastructure effect. And then finally, in Timor-Leste, and I know the minister's on the line. And by the way, I just want to congratulate the minister. I understand Timor-Leste has done a tremendous job managing the COVID pandemic. So congratulations. But and this is a great example, Carol, of MCC's incentivizing effect on reform. We're developing a compact with our partners in Timor, but before we have signed that compact, the government's passed new legislation creating the country's first water utility and put in place a water regulator for the first time. And that's before MCC's spent $1 or signed that compact officially. And so that's the sort of partnership that we work for. That's the sort of thing that tells us there's going to be that institutional investment and political will to make sure that that infrastructure is sustained. So across the board, I'd say they're all terrific answers.
Well, in fact, our audience has spoken, and it seems that water, sanitation, and hygiene has taken it away with 62%. And I know that is a big part of the project that you have in East Timor. We'll be hearing about that soon. So now I would like to ask Ambassador Maya and Minister Magalhães to unmute your mics and turn on your video. And I would like to introduce His Excellency Fidelis Lete Magalhães, Minister of the Presidency of the Council of Ministers of Timor-Leste, and His Excellency Senkatana Gabriel Maya, Ambassador to the Kingdom of Lesotho to the United States. So, welcome to the program. Is everybody on?
Yes, Carol, thank you.
Wonderful. So COVID has exposed the need to invest more in healthcare systems, but healthcare doesn't exist in a vacuum. It's essential to have the infrastructure to deliver healthcare: electricity, water, sewage, roads. As we've just seen in our survey, people understand this connection. In Timor-Leste, what are your biggest healthcare challenges and the infrastructure challenges that go along with those?
Thank you very much for FP and Carol. Thank you for hosting this. And Sean, what a pleasure. And Ambassador, pleasure as well to meet you virtually, to meet you online. Allow me just to go just straight to the point. Before this pandemic arrived, or COVID arrived, infected people here with suspects here in Timor-Leste, on 13th of May, there was a flooding in Timor-Leste. Heavy rain, and Dili, the capital city, got flooded. And the fear was that we would have a lot more people with illnesses, and it would crowd our hospitals. And we had these twin concerns of anticipating COVID and the possibility of really overburdening our health system with illnesses that would come or would be a product of weak infrastructures. So for that, I think there is no issue at all as to why infrastructure is very important, and that the main concern for Timor-Leste certainly has to do with weak infrastructures, weak water sanitation, and some other basic infrastructures. I think these are the most strongest concerns we have.
And I think the points that you bring up are really important, because while the world is really focused on COVID right now, it doesn't exist in a vacuum. You still have other things like flooding that happen, and you have to address those. Ambassador, I'd love to hear the situation in Lesotho, how you see the issues around healthcare, what you're dealing with in healthcare, and also the infrastructure to be able to support that healthcare.
Thank you very much. There is definitely a lot is happening in Africa, and also one of the things that we have to recognize is that the African leaders, of course, when they heard about the pandemic from China and France and etc., they basically took action because it was important that when it comes into Africa, they'll be prepared to handle, to contain the pandemic. Now, looking at Lesotho as a unique situation surrounded by the Republic of South Africa, it is amazing story that you may want to hear that South Africa, having 100,000 plus confirmed cases against currently 17 confirmed cases in Lesotho, you find that in most cases, there is a need that what do we do in terms of electricity and infrastructure, so that at least our nation is much more better than so that it can be able to contain the virus when it comes. So there is a lot that is ongoing, and you'll find that the government of Lesotho, basically with South Africa, they agreed to close the borders, which basically it was a kind of a plus to our country, because you know that before this closure of borders, we still have a lot of our Lesotho people in South Africa, and of course they are there, but of course they are not working, and those who are in country basically they basically try to conform with the WHO guidelines, and of course whatever the electricity that is there available, our people will try to contain and minimize all that is there. And you find that in most cases that the export of our labor mostly is in South Africa. Most of our people in South Africa, they're still there. And now in country, a lot of non-essential businesses have been closed down. In particular, again, you consider the AGOA, which employs around 40,000 plus people to work work in these firms and factories. You find that now this has actually had a negative impact on the people of Lesotho. They are just there seated at home, but the government has actually ensured that it supports them financially, so that they can't go hungry in most of the cases. And the farmers, of course, have been encouraged to have a more mass production so that our people can be able to eat, and which obviously is basically what the government is doing. And actually established the national forum, which basically deals specifically on the pandemic as it happens in the country. And the government is basically instrumental in this. And we look forward that it does help. But one of the things that is looks like it's a kind of an economic challenge, because there are no goods and services that are being produced, and people are being paid, and that is a kind of a challenge also, for the government maybe to contain that. And but hopefully with the partnership that I have seen that the government of Lesotho has partnered with the MCC, particularly trying to look at the health system and the capital investment. We hope that eventually, if the need be for the second wave of the COVID-19, then the two partners can work hand in hand and see what they can do.
You brought up so many different issues that you're dealing with, and I think that this is really the crux of the matter here, that for so long development has really been fragmented. We've looked at, you have agencies that deal with education, and another agency that deals with healthcare, and another agency that deals with sanitation. But a government is actually responsible for service delivery across the board. You don't have the luxury of saying, well, today we'll do education, we won't pay attention to healthcare. You have to do it all. And I'm wondering about all of these competing needs and competing parties in this. Sean, maybe we can go to you. How do you think that the development could be less fragmented, and so that we see these combinations? It's obvious to everybody outside, but somehow in development, we keep focusing on it.
Sure, that's a great question. The first thing I'd say is we're working closely with Lesotho and developing a second compact, and approximately $40 million of that is going to be geared toward health sector service delivery improvement. And so they've been tremendous partners. with respect to how to better align that assistance, at least from the United States side. And I think this is starting to happen. Where it's pretty exciting. The agencies need to have more communication with one another, and so the MCC has been around for relatively new, or 15 years, and we work closely with our partners at AID. We work closely with our colleagues at the Development Finance Corporation, which is the new institution replacing the Overseas Private Investment Corporation. But we see it in sort of, at least I see it on an arc, where AID is servicing poverty relief and disaster relief efforts more. MCC sits in the middle and really addresses structural enabling environment reforms and infrastructure. And then the DFC sits on top and brings in and backs private capital into those markets. And so if we know what sort of investments the DFC is looking at and what's holding those investments back or making markets difficult to invest in, it makes us better able to design our projects and look forward. And if AID understands what we're working on, then it allows us to sync. And so just on all levels, our teams have started to work very well together. And I should say, that's also with respect to the private sector, and I don't want to leave the State Department out. The State Department's just launched something called deal teams, which are available. Each embassy now is staffed with somebody who is looking for that private sector engagement and looking to make those connections happen on the ground. So all those teams have started to sync, and I think it's an exciting effort.
Yeah, Minister Megadis, I actually lived in East Timor right at the time of your independence, and when the UN was administering East Timor right before, you had so many international partners. Everyone had a hand in. It's an interesting thing. You're a very young country. You're 18 years old just last month. How have you developed that national voice to be able to withstand all this fragmentation?
Well, I think it should be rather simple. There shouldn't be anything about us without us. So nothing about us without our participation. So we have to participate in the very process, because otherwise what happens is that countries or development partners may invest on East Timor, but not in East Timor or not in Timor-Leste. So we'll have to make sure that development cooperations really benefit the host country and more importantly, the citizens of the country. And from our part in Timor-Leste, we're trying our best to do, and I think an interest expressed by MCC is a recognition of that we have made achievements on three important components. That's economic freedom and our government's commitment to invest in our people and good governance. So it is not easy. I mean, we are quite we're a new nation state. We are facing problems. We continue to face challenges, but I think there is commitment and there is a widespread and there is an international recognition. But I can proudly say that what makes me very happy as a Timorese, more importantly rather than being a minister, is that after independence, the country is free. We have foundations for a long-lasting, sustainable democratic society, democratic nation. And that I think requires some recognition from our development partners. So we deserve, in a sense, to be trusted, because we, in our part, we are committed to our people. And that I think requires some recognition. And that should give us a space, or it should give us a seat at the table to discuss about the kind of future that we think we hope to achieve, to move toward. And we should be able to have a voice about, and also an opportunity for an open and frank discussions with development partners, because frankly, we must revisit some of the existing cooperations because at the end, institutions are working and with their own logic, reasoning, and reason of being, which really, if there is no this constant renegotiations and negotiations between the host country and development partners, you surely would not be able to bring the best result to the citizens. So for that, I think we also appeal to our development partners to please to use our mechanism country system, despite the fact that, again, the system is still facing challenges, but with this engagement or cooperation that we have with development partners, we hope that our country mechanism can be strengthened. So ownership, national system or mechanisms, and an open and frank discussions where nothing can be done without talking to us and without having an engaging partnership.
I like the way that you say nothing can be done on East Timor without East Timor. So this is a very important thing to remember that's shockingly forgotten a lot of times in development. Ambassador, Lesotho is in a very unique situation. You are a country that is completely surrounded by South Africa, a country that is a much larger market and also has some of the best healthcare in Africa. I'm wondering about the issue, so often with this fragmentation of aid, the development partners want to support basic healthcare infrastructure, but they're not really very interested in anything beyond that. And the fact is that a population, you need those clinics, you need immunizations, but you also need surgery, you need cancer care, you need dialysis, you need all of those things. Now, it seemed fine for a long time for people to have healthcare tourism and just go to another country. But COVID has shown that you can't necessarily depend on that. And I'm wondering how you see it. I think you're particularly for you because you worked both in the development partners for them and also in government, how you see this fragmentation, particularly in building a full healthcare system instead of just that basic healthcare system.
Thank you very much. This really is a reality in terms of our country, in that in most cases you find that the connection of our people in the rural areas is very difficult to have an access to that. However, through the development partners, in terms of connecting the roads to get into some of these places, in terms of healthcare delivery system, you find that it is very difficult at times to get to there. And again, looking at the sanitation and water, and I think again here is basically still the kind of a challenge in our country. Looking at the topography of our country, you find that there are certain places whereby obviously, much as we would need the sanitation, but the areas themselves are very, very much inaccessible, and which of course, in terms of looking at our partners and trying to partner and maybe negotiate and see how we can move forward. Eventually, we can be able to do that. But other than that, in the rural areas, the sanitation and water, it seems to be, coming on alone, because of the kind of developments that have been going through our development partners in the future, in the future years. And I see it to be one of the kind of the challenges, basically because looking at our topography of our country. But again, it has an impact also on the healthcare delivery system. I know the MCC team, which has been going to Lesotho, I'm sure can witness this. There are some places where basically they cannot be have a position to get into. And of course, those kind of areas, it is very difficult to try and advance the kind of sanitation appropriate for the citizens to be able to enjoy the benefits of that. But again, like I said, that we always depend on the negotiations with our development partners and a cooperation and see how much we can do and, eventually get to that. But again, like I said, that the urban areas, almost everything is there in terms of trying to provide the healthcare system, though we do have a lot of challenges and which I think looking again, we talk of the development partners. we can be able to achieve some of these objectives. And I think we'll get there.
You know, Sean, we're getting a number of questions from listeners that are asking about accountability and how you can protect aid money from going to countries that are corrupt and use it for corrupt purposes. And I think particularly for MCC, you have some very interesting safeguards there.
We do. The first thing is we're very focused on corruption, and it's a hard hurdle in our selection and eligibility criteria. So one of the scorecard items that we look at is whether a government is actively taking steps to control corruption. And if a government doesn't achieve a passing score on that, they're not eligible for selection. Now, that's not to say that corruption issues are resolved if it's a passing score. What that indicates is it's a government that's investing political capital and making the effort to get there. And we want to back that. So we support institutional reforms, transparency, the sort of things that that make corruption harder to practice. And in country on a project, for example, what that means is we set up a separate entity. It's called an MCA. It's a project execution entity. It's got its own CEO with a merit-based selection. It's got its own board of directors. It's got its own project management team. And it is responsible for an open and fair procurement process. It's responsible for merit-based hiring. It's responsible for enforcing the environmental standards and the gender and social inclusion standards that we have, the sort of economic analysis that we need, and the consistent stakeholder communications that are necessary to make sure that the project is working. The more people that are bought in, the more eyes there are on it, the harder it is for corruption to take root. And the final thing I'd say is MCC money is grant money, but it isn't simply a check that's handed over. In fact, it's paid direct from the US government to those contractors, and it's tranched out based on conditions precedent that are met with our partner countries. And at a minimum, it's a quarterly tranche that's assessed by our team in conjunction with our partner governments and MCAs to make sure that those standards are being met. We've had, in over 40% of our projects, we've curtailed or withheld or cut funds for a variety of purposes, but there is direct accountability. Our partner governments are accountable to MCC. MCC is accountable to the American taxpayer. It is part and parcel of the entire design of the agency, and frankly, it's what makes it work.
And I think it's an important issue to bring up that you can't just paint every country with the same brush. You can't paint every development agency with the same brush. There are some that are very concerned about this and others that unfortunately are not. I wanted to move on with an audience question from Andrew with Global Green Cross. He is asking if telehealth is a relevant solution in Lesotho and East Timor. Maybe, Minister, if I can start with you, because I think that East Timor, being on an island, is even more susceptible and needing to have telehealth.
So can you repeat?
He's asking whether telehealth is a relevant solution in East Timor for you, that by healthcare via the internet.
Oh, well, it is very relevant, and in fact, we are in the process of trying to promote e-government, electronic governance in Timor-Leste. So far, we're still facing problems with internet connectivity, and we are in the process of finalizing a fiber optic connection from Australia, linking Australia to Timor-Leste, which will give us better access to internet facilities. The backbone has already been established throughout the country, and but we have yet finalized the initiative. So we hope that by probably a year or so, we can move more aggressively on that. But considering that the country you were here, you have been to Timor-Leste, you know the terrain, you know the geography, you know the challenges of having to climb all these very difficult and manageable hills, and
I remember those.
with constant problems of flooding and real challenges we face. I think the government must invest more, and we should aspire to have facilities that can allow us to deliver services, to have consultations through these non-physical means. So I think it will be very important, and COVID-19 has made it more relevant to us, as you know, schools cannot really function where healthcare providers cannot really go and provide consulting services or giving advice to the patients. So some form of e-government, some form of electronic communications would certainly benefit the development, and would certainly make the government more responsive to the day-to-day needs of the citizens. So we hope that we can improve our infrastructure soon.
Well, thank you. And Ambassador, you know, one thing that COVID has really brought up is the importance of connectivity. As the minister has talked about, you know, you have students having to learn online, you have medical services being given online, you need government to do things online, and yet connectivity in Africa has been a real challenge. Can you talk about the situation in Lesotho and what you're doing, particularly as an ambassador? I think one of your main functions is attracting investment, attracting businesses coming in. So what are you hearing from businesses that could come in and help with those situations?
Yeah, thank you, Carol. Yes, this is an important question, particularly when you look at the telehealth. I think it's in Lesotho, obviously it can work, but you'll be saying now you target a certain group of people. Because basically, when you look at the topography of a country, there are a lot of places whereby internet services you cannot get. And obviously, that's why I say then, if you look down at the urban areas, that is where then the telehealth can appropriately work. But again, most of the population again is in the mountains where you cannot have internet services. And of course, you can see that it will need a lot of financing to ensure that telehealth can be well spread over the country. But again, to me, I consider it's one of the advancements that the country can think of, which I think is important. Maybe looking at the development partners, you can say, how visible is it? How visible is it that telehealth can be incorporated within the health system in Lesotho? And of course, yes, when you look at the COVID-19, as the minister has just said, yes, we need to advance in the very advanced technology, machinery, so that we can be able to ensure that we save our nations. But again, like I said, that looking at our country, Lesotho, yes, there are a lot of places basically where there is no access. Roads are not, you cannot access because there are no roads and internet. If you talk about internet services, whereby obviously when you talk about telehealth, then of course it's obvious that it can be explored, but again it needs a kind of a lot of money, in terms of health infrastructure to be able to do that. But again, it can be a good idea that the telehealth can be operational in the country, and because again we do have the population that is can make use of it where there is an access in terms of the internet. But those other people, of course, you're looking at our country, honestly, it will be very difficult and cost effective to explore to that. But again, I say it depends on the Lesotho government and maybe the development partners of how they can see it fit.
Yes. And again, you know, you're talking about being able to bring in internet, and at the same time, you need different infrastructure to be able to bring that in. And again, it's the interconnectivity.
Yeah.
Sean, we have a nice challenging question for you.
Terrific.
From Sanjeev Gupta. He asks, a particularly difficult matter is to rely on market data and market intelligence in developing markets and use data blindly. How do you corroborate data with actual reality on the ground? Or else you run a big risk of flawed conclusions and working with the wrong partners or the wrong projects. I'm always reminded of when I was in college, the textbook, How to Lie with Statistics.
Yeah.
So we're looking at data, and that's a great thing, but can't we also lie with data?
So I will tell you that MCC's staff are some of the most talented people, I believe, in the United States government, I'd say the world, and they are experts at going through data analysis, rigorous analysis, testing conclusions, testing theories, and making sure that those results speak for themselves. And I'll give an example. We have, I was just chatting with our country team lead, a woman named Hannah Freymiller in Timor-Leste, and we're working through on the ground in Timor-Leste with a team of people, our economists, our analysts, with a team from the Timorese government. And that's led to the development of a project that's going to be aimed at water disinfection, sanitation, and drainage infrastructure to the tune of roughly $200 million. All that data has been processed to lead us to that result. And so we really rely on our Department of Policy and Evaluation and our Department of Compact Operations to work with our partner governments, access local data on the ground, talk to people in country. This isn't a white paper that's issued from an office here in Washington, D.C. This is something that's country-led. It comes to us from our partner countries, and we work with teams there, government officials there, analysts there, and like I say, the civil society stakeholders who are impacted. So not only are we looking at numbers and data, and obviously data is country by country, it's different. The quality, it ranges in quality, it ranges in access. So there's no better way to do it than get our feet on the ground and go see for ourselves. And that's what we spend an enormous amount of time doing.
But I think that also speaks to, you know, the amount of resources you put towards making sure that people really understand the data. It speaks to the fact that you really can get swayed by data in the wrong way. And it's important to really understand that data. We have another question, actually for you as well, from Gail Strickler. Is MCC doing anything to encourage the development of needed contracting ability indigenously, or are you relying on US-based contractors to deliver these services?
Yeah, no. So local capacity building is a hallmark of the agency. It's what we're designed to do. This is something that's very important to us, and I'll give just one example. In Malawi, the state power utility formerly included no women. And so part of our compact demanded a gender inclusion unit and sponsored STEM scholarships for women in Malawi who have gone on. There have been multiple graduates. Talked to one when I was there, a woman named Grace Gambi, who came back. She is now working to develop the second compact that we have with Malawi. She wants to be there on the ground and helping. And that's just it's a small anecdote, but we do this country by country. And I should say also, with respect to the data, to Sanjay's question, we publish STAR reports and evaluation briefs, which are full-scale overviews of our projects what worked and what didn't work, and what we learned and what we're applying to projects moving forward. So it's an iterative process, and it's a very public and transparent one. And that's something that the agency is very proud of. That's why we have the high transparency rating from Publish What You Fund. And everybody who has any interest in it can get any information they want on our projects on our website.
You know, Ambassador, I think that this issue of using indigenous firms is a really important one. And one thing that really has come about from COVID is seeing that the supply chains are really just too long. And you can't go so far to get things. You know, countries that don't produce their own PPPs or ventilators or other critical care things, they're having a hard time getting them. And again, Lesotho is in the middle of South Africa. You've closed your borders. It's really shown the trouble of having such long supply chains. At the same time, you really have a very strong manufacturing base. I'm wondering what you're going to be doing in the future to shorten these supply chains.
Thank you so much, Carol. I think this is a very important question. Since you know that AGOA, as it is, has employed a lot of 40 plus women, I think that could be one of the apparel that the government can think of in case we have the second wave of COVID-19. Other than export markets, and we need to ensure that the government should should look into ensuring that we stockpile some of this PPE, because currently we do get all this from abroad, China, you name it, and it's very difficult for our people to be able to have all this at the same time. And it would be an ideal, therefore, that other than only the firms that are there in country, we can look and see that we do have maybe established a kind of a manufacturing that can work on the PPEs, so that at least they're available, because we never know if there's going to be a second wave of COVID-19, which I think, yes, Lesotho can benefit out of that, and also that could also create employment of our people who, most of the time we sell our labor into South Africa. That could obviously in country can be able to, a great employment for our people, and, be able to live and sustain their lives.
Well, we're just about to wrap up, but Minister, I just wanted to ask you one more question. You had told me the other day about a story of your first president, President Shanana, his wife, going up country and talking to some people from a development project. And it really highlighted how important it is to have indigenous knowledge, indigenous companies working on issues. I'd love if you could share that with us.
This is a story which I heard from some friends about a visit to a village by the wife of one of our founding fathers. When the wife went to a village, we went to that particular village, she asked the villagers about how they were doing. And I told her that I had received so many visits from agencies to advise them to wash hands, and they realized that I told them that the biggest problem in that village was this stubborn diarrhea, and they were told 2,000 times or thousands times over about the need to wash hands. But then the villager asked the wife of the then president. The villager told the lady that, it is interesting that they all came here and to tell us that we need to wash hands, but they have never asked us whether we have water. And in fact, it is, I think, it is not only a matter of, it is a combination both of knowledge, of understanding the reality on the ground, but I think more importantly, there has to be a coordination at a national level, coordination with all these different actors in the field, ensuring that we know what the real challenges are and how we can work together with the government, with different competing actors. But what strikes me about this MCC engagement with Timor-Leste, at least from our experience, and Sean has described some of the methods and approaches that the MCC has introduced. But more importantly for Timor-Leste, from my own experience, is that the host country, we have to be as open as possible. We have to be open, we have to allow all array of conversations with different stakeholders, with different development partners. And then in the process, we really have to be really frank. We have to be frank. We have to recognize our own potential, but then the challenges facing the country. So we must not, claim that by virtue of being the government, hence we know every solution or every problem there is. In fact, this exercise of finding a root cause or conducting a root cause analysis and then approaching it from an economic angle of investment rate of return greatly help host governments, I think, because host governments then can really perhaps realize that, in fact, they have been wrong all along, that they had focused on wrong problem. That if they were to focus on to conduct the same exercise of conducting a thorough analysis, they could have managed to solve some of or at least an underlying issue and solving all other corollary or related problems that may come out from that particular problem. So I think that pragmatism, which I think drives MCC, is rather important, because you'd have to be very open, critical, even analytical in your approach, and because only by doing so, then you can really sit down and realize that, in fact, some of perhaps previous interventions had all been rhetorical or political, had been wrong, had not been useful, and perhaps it is time for the government to take a deep breath and say, look, I've been wrong. And let's focus on what is really important for the people. I think this exercise has been very powerful, I admit. And again, going back to the first part of my statement of this particular part, is that the host government has to be open. You have to be open. We have to have a frank and open conversation. We have to have a thorough analysis. And this is an important analysis, I think, root cause analysis, which also will greatly help the host government, because then suddenly we realize that we don't have data on many things. And then we really have to make a special effort to really get all this to get the information right and to get the correct information. So I think this was just a way of sharing, so at least the experience we have, and let's hope that we are in the process of a feasibility study with the MCC. We have a water drainage, and we also have an education project. Let's hope that Timor-Leste will lead in the process, and I think we are. This is not a rhetorical statement. I think I'm very happy and proud to represent my country and to realize that how committed we are, and when to hear it from development partners after going through a certain exercises that are based on consultations with all different stakeholders, and suddenly they conclude that the government, despite the weaknesses, is really committed to invest on its own people. I think that gives me a particular joy.
Yeah, I think also it's really important what you talk about of this searching for what it is that you want, the root analysis, that you've done that for yourselves. You haven't done it for an outside entity. You've done it for yourselves. It's ended up, it will be useful for an outside entity. But I think it's the importance of looking at it yourselves and prioritizing that yourselves.
No,
you know,
we are half island, but we're not really an island. So it's very important. It is very important to have to engage with all different actors with perhaps stronger capability and skill sets and the know-how to help us solve development challenges in our country.
Yes. Well, unfortunately, it's almost time to wrap up. In fact, we're a little bit past it, but I wanted to give our panel the chance to share some closing thoughts or key takeaways from this conversation. And just very briefly, perhaps we can start with you, Ambassador Maya, and then the minister, and then Sean to finish it. So Ambassador, please.
Yeah. Thank you so much, Carol. For me, and on behalf of the government, I think this has been a worthwhile exercise and kind of a visual dialogue, because I think I have learned a lot from this dialogue, and which of course here representing our country are some of the things that I can take home with, and then maybe inform our foreign affairs about this, and also for us to be able to see how we can do in terms of the COVID-19, with again with the development of our country into the future. Thank you so much.
Minister, please.
Well, I think there is a hope that we might be able to solve or reduce, not solving, pardon me, but to reduce poverty significantly in Timor-Leste and bring prosperity to the citizens of the country. But we cannot do it alone. We will need development partners, and in this case, we will need MCC, the United States of America, and I think it is about time that we focus on infrastructure. I think it is about time that we focus on infrastructure.
Thank you. Sean?
Well, I'd just like to thank the ambassador and the minister for the tremendous partnership that we have with your governments. We're very proud at MCC of the work that we're doing. And I think that the open, transparent, and accountable development that MCC engages in is a fantastic example of the way the United States goes about practicing development assistance. And it's going to have a lasting impact. And we're looking forward to continuing our work. Thank you for having us, Carol.
Thank you so much. Before we wrap up, we want to check in with the audience again for another quick poll. As before, the poll can only be accessed by our audience on Zoom. So a window should now be appearing on your Zoom screen with the polling question. So please select and submit your response. Looking ahead, how confident are you that additional investment into the infrastructure required for healthcare will help communities weather future shocks? And the answer choices are very confident, moderately confident, not confident, or unsure. Yeah. And this is, really one of the most important issues that we've been looking at is the issue of resilience. We're all focused right now on COVID-19, but this is going to pass at some point. And what we need to do is to build a kind of resilience that enables countries to be able to withstand these kinds of shocks. And certainly what we have been talking about today is a big part of building that kind of resilience. So I think we'll have those, the results. Annie said, there we go. So people are somewhere between very confident and moderately confident. So that's really good that the vast majority are on the positive side. And of course, only the future will tell, but this has been a fascinating conversation. As always, I'm sorry to have to end it here. It's been truly fascinating and an insightful conversation. Thank you to our distinguished panel, Ambassador Maya, Minister Magalhães, and Sean Cairncross for taking the time to share their perspectives with us today. Again, a big thank you to the Millennium Challenge Corporation for partnering with us on this virtual dialogue and for your leadership in this area. Please stay tuned for more upcoming virtual events here at Foreign Policy, including a virtual dialogue next Tuesday, June 30th, on the surprising links between the coronavirus, climate change, and inclusive government, and what the current crisis teaches us about preparing for future global threats. So again, more about the interconnectivity. More information on this event is at foreignpolicy.com/events. Thank you everybody for joining us today. Take care and we'll see you soon. Thank you.
Thank you.
Thank you.